Metoclopramide. Metoclopramide is a prokinetic drug. Prokinetic drug are the drugs that promote coordinated movement of GIT and hasten gastric emptying. Drugs that promote coordinated movement of the GI and hasten gastric emptying are called prokinetic drug. These include metoclopramide, domperidone, mosapride, etopride and cisapride and levoserpiride. So most of these are ending with the word pride. Mosapride, etopride, cisapride and levoserpiride. Example of prokinetic drug: metoclopramide, domperidone, mosapride, etopride, cisapride and levoserpiride. These are the drugs that promote coordinated movement of GI and hasten gastric emptying. Of these, metoclopramide and domperidone are used as antiemetics. Okay. So metoclopramide is a dopamine D2 receptor antagonist. It is a D2 receptor antagonist. It has two important action, central and peripheral. Metoclopramide has two action, central and peripheral. The central action. The anti-emetic effect of metoclopramide is mainly due to the blockade of D2 receptors in the chemoreceptor trigger zone. At high concentration, it also blocks 5-HT3 receptors in the CTZ region. So, जो anti-emetic effect होता है metoclopramide का, that is due to the blockage of D2 receptors in the CTZ. High concentration पे it also blocks the 5-HT3 receptor in the CTZ. Anti-emetic effect is due to the blockage of D2 receptors in the CTZ area, due to the blockage of D2 receptors in the CTZ areas and due to the blockage of 5-HT3 receptors in the CTZ area. Prokinetic effect on upper GIT. metoclopramide D2 एंटागोनिस्ट होता है, 5-HT4 एगोनिस्ट होता है और 5-HT3 एंटागोनिस्ट होता है. metoclopramide is 5-HT4 एगोनिस्ट, D2 एंड 5-HT3 एंटागोनिस्ट, जिसके कारण एसिटाइल कोलिन सीक्रेशन इज इंक्रीज्ड फ्रॉम द माइंट्रिक मोटर न्यूरॉन्स. metoclopramide increases acetylcholine secretion from the myelinic motor neurons. Metoclopramide increases the acetylcholine secretion from the myelinic motor neurons. Metoclopramide enhances the release of acetylcholine from the myelinic neurons. Metoclopramide, it increases the acetylcholine secretion from the myelinic motor neurons. This effect is due to D2 antagonism and 5-HT4 agonism in the GIT tract. Thus, peripherally, it has prokinetic effect on the upper GIT and enhances the rate of gastric and duodenal emptying. ठीक है, तो upper GIT tract में it is D2 antagonist, 5-HT4 agonist, जिसके कारण acetylcholine का secretion increases from the myelinic motor neuron and thus it has a prokinetic effect. ठीक है, ये गैस्ट्रिक एम्पटिंग को इन्हांस करेगा और जीआई के कोऑर्डिनेटेड मूवमेंट को रेगुलेट करेगा. सो द इफेक्ट ऑफ metoclopramide ऑन द अपर जीआई ट्रैक्ट इज increase in the tone of lower esophageal sphincter, increase in the tone of lower esophageal sphincter, increase in tone and amplitude of the antral contractions, relaxation of the pyloric sphincter and increase in peristalsis of small intestine. ठीक है, तो जो metoclopramide है, it increases the tone of lower esophageal sphincter, it increases the tone and amplitude of antral contraction. ठीक है, LES का टोन इंक्रीज करता है, antral contractions के टोन और एम्पलीट्यूड को इंक्रीज करता है, पाइलोरिक स्पिंचर को रिलैक्स करता है, इट इंक्रीजेस द पेरिस्टाल्सिस इन स्मॉल इंटेस्टाइन. तो ये LES के टोन को इंक्रीज करता है, पाइलोरिक स्पिंचर को रिलैक्स करता है, एंट्रल कॉन्ट्रैक्शन के टोन और एम्पलीट्यूड को इंक्रीज करता है and increases the peristalsis of small intestine. Thus, it promotes the forward movement of contents in upper GIT. It does not have any significant effect on the motility of colon. This is the diagram for effect of metoclopramide. Okay. Metoclopramide, it blocks D2 receptor in the basal ganglia, जिसके कारण एक्स्ट्रा पिरामिडल सिम्टम्स होते हैं. Metoclopramide blocks the D2 receptor in basal ganglia, which results in extrapyramidal symptoms. Metoclopramide at high concentration blocks the 5-HT3 receptor, and it also blocks the D2 receptor. Metoclopramide blocks the D2 receptor at high concentration and blocks the 5-HT3 receptor in the CTZ area. Metoclopramide CTZ एरिया में D2 और 5-HT3 को ब्लॉक करता है. Metoclopramide has prokinetic effect. It increases the tone of lower esophageal sphincter. It relaxes the pyloric sphincter and duodenal bulb. It increases the peristaltic movement in upper GIT. So this is the mechanism of action of metoclopramide. ये 5-HT3 और D2 receptors को ब्लॉक करता है CTZ एरिया में. इट हैज़ प्रोकाइनेटिक इफेक्ट, ठीक है, बिकॉज ये D2 एंटागोनिस्ट होता है और 5-HT4 ईगोनिस्ट होता है. यूजेस एज एन एंटी इमिटिक इन गैस्ट्रोइसोफेजियल रिफ्लेक्स डिजीज to alleviate symptoms associated with gastric stasis in patients with diabetes, post-operative or idiopathic gastroparesis. Okay. To stimulate gastric emptying before general anesthesia in emergency surgeries. Metoclopramide has been used in the treatment of intractable hiccups. So, metoclopramide is used as an anti-emetic. Okay. It is used for the prevention and treatment of disease-associated vomiting, drug-induced vomiting, post-operative vomiting, cancer chemotherapy-induced vomiting, and vomiting due to radiation sickness. It is used as an antiemetic for the prevention and treatment of disease-associated vomiting, drug-induced vomiting, disease-associated drug-induced, post-operative cancer chemotherapy-induced vomiting, and vomiting due to radiation sickness. Okay. It is used in GERD. It is used to alleviate symptoms associated with gastric stasis. It stimulates gastric emptying before general anesthesia in emergency surgeries, and it is used in the treatment of intractable hiccups.